Hi, my name is Mariya Vizireanu, and I am from the Thomas and Dorothy Leavey Center for the Study of Los Angeles, also known as Study LA at Loyola Marymount University. And I've been an AAPOR member for 1 year.
And my name is Brianne Glibert, also from Study LA. I have been an AAPOR member for 12 years. In the public opinion research world, rare is the opportunity to be called into service. However, that is exactly what happened earlier this year. In March, the mayor of Los Angeles, Eric Garcetti, called on our research team at LMU to help his team understand what Angelenos were thinking about and how they were reacting to the COVID-19 pandemic. Over the next week, by far our shortest timeline, our team developed, tested, translated, and programmed a survey to query 2,000 adult Angelenos. These 2,000 adults were all residents of Los Angeles County, and we contacted them via phone, both landline and cell, and online in both English and Spanish from March 23rd to April 8th. After data collection, the data were weighed, and we had a margin of error of plus or minus 2%. A link to the report is in our last slide, and the full methodology is here as well, as we are charter members of the Transparency Initiative. A quick glance at this demographic summary shows the representativeness of our survey with results from Angeleno residents. On this slide, we wanted to call out the percentage of residents that said they had someone in their household with at least one of the two main risk factors, either a serious medical condition or compromised immune system, or someone 65 or older. Nearly half of all of our residents said that someone in their household fit into at least one of these two categories.
And as for our survey results, here are some highlights, both for the entire sample of residents and broken down by geography, city of LA versus rest of the county. I will go over results for the entire sample. An overwhelming majority, 86% of Angelenos believe that the coronavirus is a real threat, and just 14% say that it is blown out of proportion. 95% of Angelenos support the decision to implement the safer at home order, and this support remains high across all racial and other demographic groups. Over half also believe that the local government's response to the pandemic has been just about right, and 1 in 3 say that it has not been enough. Asian respondents and younger Angelenos are the most likely groups to say that the response has not been enough. We also asked how much confidence residents have in the following individuals and groups to deal with the pandemic. Over 80% have confidence in their local health department, City of LA Mayor Garcetti, and California Governor Newsom. Only 38% have confidence in Trump to deal with the pandemic, which corresponds with other surveys we've done in our very liberal region. Another set of questions assessed how worried Angelenos are about their ability to perform a range of duties during the pandemic. More than half are somewhat or very worried about a number of issues listed here. By race, Latinos are the most worried, while Black respondents report the least amount of worry. These results are not surprising, especially as half of Angelenos report being let go or having their work hours reduced, with Latinos reporting these adverse events at a higher rate than other groups. And consequently, 58% of Angelenos had their household income streams reduced due to the pandemic. Again, Latinos are most likely to report a reduction in income. Another worrisome situation is that about 1 in 5 Angelenos have no one they can depend on for care, whether it's in or outside their household, making this difficult time much more difficult without a safety net of those around them. Some positive news: most respondents gave accurate answers to the ways one can protect themselves and others. You can see 3 out of 4 discussed the importance of social distancing in their open-ended responses to this question, and we have seen that public health messaging works. For instance, before LA County officially recommended that Angelenos wear masks outside, only 21% of survey respondents mentioned masks in their answers. After the official recommendation to wear masks was announced on April 3rd, half of respondents mentioned masks on the survey, a significant increase.
The results that Mariya quickly reviewed are just a few of the highlights from our survey. Before we start a project, we always try to articulate our why so that we stay focused on the goal at hand. Having the opportunity to present to and discuss these findings with the mayor and his COVID response team on several occasions provided us with one of our biggest whys yet. In addition, the mayor included the findings during 6 of his nightly press conferences, including one where I had the opportunity to join him to share my highlights of the data. The results were also used to tailor public health messages to the demographic categories in geographic areas identified as least knowledgeable about COVID-19. And speaking of the data, our full report of all the tables and crosstabs of our survey is available at this bit.ly link. Thank you for your time and have a great rest of the conference.